We are all paying more and struggling to keep up with the health insurance costs. Over the last 10 years, average family premiums in employer plans up 50%, deductibles up more than 40%. We have an expert here to help explain why healthcare costs are so high. Welcome now, former insurance executive and president of the Center for Health and Democracy, Mr. Wendell Potter. Wendell, welcome. Talk to us about why families are paying so much more.
Two words, corporate greed. The big insurance companies that control health insurance in this country have become part of big corporate conglomerates to the point that many of us get coverage, for example, from United Health Group, which is the third largest company in America by revenue. Only Amazon and Walmart are bigger. And these companies have figured out how to squeeze us in so many different ways by charging us excessive amounts of money for our premiums. The average cost of a family policy now reached $27,000 last year. Even with that, they demand that we spend a lot of money out of our own pockets paying for care before their coverage, they'll pay a dime before our coverage kicks in. They also are increasingly saying, no, we're not going to cover what your doctor says you need just because we can say that. They can declare something that's not medically necessary or appropriate and refuse to pay for your coverage. So they delay and deny care. That's why you're seeing so much rage at these companies. Americans are waking up to realize that the real villain in health insurance are big corporate insurance companies.
It feels like we're paying so much more and we're getting so little value, and we feel like, what's our recourse for that? We're paying for the premiums and taxes are coming out of the paychecks plus the copays. All this money is going to the corporate, and then how are we getting what we're supposed to get?
You're right, and we are not getting the same value. They've devalued our coverage even as we pay more. And there's a term for this in the industry. It's called benefit buy down, and it happens every single year. The value of our coverage gets less and less. That doesn't happen anywhere else in any other part of the economy.
Huh.
We need to insist that our lawmakers hold these companies to account. We need to tell our employers if we get our coverage through the workplace. This makes no sense. They need to work together, they being employers, to figure out another way for us and not have to work with these big corporate Goliaths again. They're robbing us blind, both as workers and as taxpayers.
Where do we go for more information or suggestions for recourse, and how do we make this change?
Go to the nonprofit that I led and that I formed. Is called the Center for Health and Democracy. And also we publish a newsletter called Healthcare Uncovered. It's on the Substack platform. It's new, it's new content every day, and it's free. There's no cost. So we want to make sure that everybody has access to what we publish.